And Terry, you're going to record.
I am.
You can start whenever you're ready.
We're live.
Good afternoon, everyone, and thank you for joining us. My name is Michael Spath, and I'm the Executive Director of the Indiana Center for Middle East Peace, based in Fort Wayne, Indiana. We're the Indiana voice for peace, justice, human rights, and intercultural encounter. I'm also a member of the Palestine-Israel Network of the United Church of Christ. To prevent Zoom bombing, we're keeping your screens muted. If you'd like to submit a question to our guests, please do that via the chat function at the bottom of the screen, where I'll be monitoring to take your questions. We also want to say a word of thanks to Ben Clemmer from WBOI for recording this to make it available to a wider audience at a later date. Today, we're delighted to speak with Siglinde Weinbrenner, the representative for the Lutheran World Federation Jerusalem program, and Dina Nasser, Chief Operating Officer of Augusta Victoria Hospital, the only specialized hospital for cancer and kidney disease patients in the Palestinian territories. Welcome to you both. I'm really grateful. This is a real treat for me, an honor for me that you're joining us today. So thanks to both of you. I want to get right to it, ladies. Israel and the West Bank are dealing with renewed outbreak of the coronavirus, leading to proposals and measures intended to curb its spread and mitigate the crisis by both Israeli and Palestinian authorities. The statistics in Israel, over 33,000 have tested positive for the virus, with over 14,500 active cases. 340 plus people have died. In the West Bank, close to 4,400 active cases and over 20 have died. And the Palestinian health minister says that the situation in Hebron is, quote, spiraling out of control. So if you could just share with us today, as of today, July the 9th, where things stand and the role of Augusta Victoria, and I know you're very dedicated staff.
Dina?
Yeah, well, to us, it has been a challenge. Internationally, people discuss access to care, and Palestine is unique in that it already has challenges in access to care. Access to care for patients coming to Augusta Victoria Hospital is challenging because the hospital is in East Jerusalem and any patient needs a permit from the Israeli authorities to come. We serve Palestinians from West Bank and Gaza. So again, that's another challenge for people in Gaza who have been under siege and closure for more than 10 years now. And at the same time, the cumulated challenge became more evident as we serve patients with chronic diseases. With COVID, people with chronic diseases get forgotten. You know, they become a third priority because people are dealing with emergencies, acute emergencies and infections. However, our biggest challenge was how to maintain services for our chronic diseases under COVID. You cannot stop services for dialysis. We're the only hospital that provides dialysis for children. We have 44 children, almost 50 children now actually, that take dialysis, and we're the only hospital. Trying to mobilize them to other areas was impossible. And we're the only hospital that provides radiation therapy. Radiation therapy, you cannot stop. I mean, once you start radiation therapy, if you stop it, you are actually risking outcomes for patients. People will have a poorer outcome because there'll be more deterioration. And this was the biggest challenge for us as Palestinians in East Jerusalem. And Augusta Victoria mobilized to try and mitigate all the risks related to the access, yet still having to balance the risk with crowding people and bringing them into the hospital, into hotels belonging to the hospital under the COVID-19. Do you want me to
Siglinde,
go
do you
on?
want to add, Siglinde, do you want to add to that, or?
The Augusta Victoria Hospital was very fast, I would think, in preparing for this scenario, because we knew from the very beginning that we had to deal with patients that needed our life-saving treatment. And at the same time, we had to make sure that, that the virus wouldn't be spread in the hospital, but that we had to treat the people. So from the very beginning, we had like a team. We built a team of the leading hospital doctors and managers also. And it was like sometimes we discussed individual cases, hotspots. What can we do? How can we make sure? How can we check and screen beforehand? And also, I think one of the most important thing was to be able to protect our staff, because that was really very important, to have the personal protective equipment available. And we were very glad that we had partners that came to help. For instance, the Evangelical Lutheran Church of America, they gave us a grant with which we could start purchasing protective personal equipment. Also the German Federal Ministry for Development and Cooperation, they came to help of us. And what was very important, that from the very beginning, we also knew that it's important that we are able to do tests. And that was really that was not easy, because first of all, you have to have the facilities, you have to have the equipment, and most importantly, you have to have experienced staff. And so we had this, and our doctor who was in charge of the lab, we really worked on this, and until we got then finally the authorization of the Israeli Health Ministry, because you need this, being a hospital in East Jerusalem, and also you need to have your test being accepted and being registered and so on. And that took us a lot of time, and the staff has worked tirelessly to make this happen. And that really helped us then also to contain the spread of the virus. And so I have to say that the month of March was so busy for us in being prepared and also training the staff, assuring the staff that they know what to do. And I have to say that Dina Nasser played a very important role there, being responsible also with the unit of the infection prevention. And it was a great learning process for all of us.
Did I see pictures of tents out in front of the hospital? And I guess in addition to that, I wanted to ask you about PPEs, ventilators, masks, the testing. So if you could just wrap all those into an answer, that might help. Yeah. So and what are some of the implications of what you were just saying?
Well, when I said about maintaining services, the most important was to protect the patients first and protect the staff. I mean, actually, in fact, with COVID, everybody's talking about protecting staff before protecting patients, because at one point in time, you might not find enough staff to care for the patients. And so we've actually set up tents because we needed some kind of triaging area for the patients. At the same time, we needed an area to screen and treat suspected cases and ensure that they do not enter the hospital. And so also we shifted our facilities and transformed one of our units into a COVID center for patients who would test positive, because we knew being in East Jerusalem, it would be challenging. Our patients come from West Bank and Gaza. If we had one of our chronic disease patients diagnosed, transporting them back into the West Bank or even Gaza is impossible. Gaza is impossible. And at the same time, even transporting them in the West Bank becomes ethically we are responsible for our patients. So even if they acquire the COVID infection in the community, we would have to be responsible. So we had a makeshift area for suspected cases. The tents were set up for the donning, what's called donning and doffing areas, to dress up with all the protective equipment, and areas to doff, to take off all these personal protective equipment. And I want to sort of make it a bit more visual. I mean, the literature shows that there's three prongs for access under COVID. People either cannot access their healthcare services because of the COVID, and especially in March and April, and chains of supplies across the world became disrupted. So you might have a disruption in medications, actually, and treatment. The other access would be lack of access, geographical access, because of shutdowns and lockdowns of areas. And the third access is a psychological access. People refusing to come because they are scared.
Yeah.
Now, we were lucky at our hospital that our hospital has a very good supply chain and had preempted and stocked well enough to be able not to have, a disruption of materials and stocks and supplies for treatment, as well as staffing. And what Siglinde was talking about, even with staffing, we had split our staff into 2 groups of 14. Should a group be infected, at least we know there's a backup group. In that aspect, we closed that part. Now, as far as access to services because of lockdown, we faced that. The first area to be locked down was Bethlehem. In fact, we have a lot of our staff, I should say maybe a quarter of our staff living in Bethlehem, and the other quarter coming from the south, which is Hebron, south of Jerusalem. So we had staff not coming in, and we had patients completely locked down. We mobilized. After 1 week of that, we managed to mobilize and coordinate with the Ministry of Health Hospital in Beit Jala, send all our chemotherapy protocols prepared in our pharmacy by our car to a point where the checkpoints, where the Palestinian checkpoints for the lockdown on Bethlehem, and coordinating, of course, crossing the Israeli checkpoints out of Jerusalem, and delivering the chemotherapy through our staff who were caught in Bethlehem, going and being on duty in the Ministry of Health Hospital and treating our patients. I think this was a model we were very proud of, because we were able to mobilize and utilize the human resources, as well as ensure safer outcomes for our patients. We had lots of patients, some of them are women with breast cancer. Should they have had such a delay in their treatment, their outcome would have been affected. The other lockdown, which unfortunately is very much intermingled with the political situation, is the patients coming from Gaza. Gaza, to protect itself, because it's been under closure and more like imprisoned for 10 years by the Israelis. The Gaza, to protect themselves, the Ministry of Health, in fact, instituted a quarantine period. Any patient coming back from Jerusalem or the West Bank had to go into quarantine in Gaza, because they basically could not afford 1 case of COVID in Gaza itself. It would have been detrimental. So so many of the patients started hesitating coming out, and also access, people were scared. So the patients of Gaza had the psychological and the physical barriers to access healthcare. We as AVH tried to mobilize. We had actually 400 chemotherapy patients, 200 were coming. We had a defaulting of 50% of our patient population. So we started to advocate for trying to secure the medications in Gaza for our patients as an interim response. And that was not easy. That was a big challenge. And the Ministry of Health tried to do that by contracting an interim service, which is now proving to be failing. So basically, when you look at levels, let's say degrees of oppression or degrees of people having the rights denied, Gaza tops it all. So basically they are under siege. Then they usually have their access denied. Now under COVID, more access is denied. And really the detriment on life and outcome and quality of life accumulates. And Siglinde has a few examples on that as well.
Well, I'm glad you said something about Gaza, because we've had a couple of questions about Gaza already. And I know from reading some of your reflections, Dina, from your time leading Augusta Victoria's medical mission during the Great March of Return, caring for victims of Israeli snipers there. I know that you have a special place in your heart, and Augusta Victoria does too, for not just, in general, the population of Gaza, but for the kids in Gaza who need that kind of specialized kidney dialysis and other medical care. Siglinde, do you want to say a quick word about Gaza, and then we'll move on to some other questions?
Yes, I mean, as Dina said, there are already lots of issues for people in Gaza, even without COVID-19. Now that was also adding, as Dina explained, but now due to the annexation plans of the Israeli government, and as you know that the Palestinian Authority, they have announced that they're going to cancel all coordination with the Israeli authorities, and that is also affecting patients from Gaza because there is no coordination now, which means that patients don't really know how to, there is no address anymore of how to get a permit. And we started, and like NGOs and hospitals started to directly then, be in touch of the medical referral officers in Eretz. And so, like, I mean, we have a unit in the hospital that are looking for the requests, that issuing requests for permits for patients to come. And then last week, for instance, out of 140 requests that were issued, only 15 people could come from Eretz. And then the answer was from the Israeli medical officers there, well, there is cancer treatment now available in Gaza, or they would say, no, there is no coordination with Palestinians, because it's so unclear. Like, I mean, July 1st has passed. That was the date for the annexation. And of course, we know that there are some delays, but the plans are still there. The implementation is just postponed, I would think. And there is a kind of a stallment. There is a kind of a lack of coordination, and also the international organizations are not really, or the UN organizations are not really able to cover up for this, because the political situation is so unclear on both sides, and the victims are the patients. So we started to do our own coordination, but of course there is no oversight anymore. Like an UN organization should have an oversight of who is denied and to follow up on cases. So patients are left by themselves. They call us, and we are also able to help. But with that message, that was a false message, that cancer treatment would be available for patients, for cancer patients in Gaza, made the situation more difficult. Now we had meetings with the WHO and also explained to them that this is not the case, that even if they, I mean, it's not something against the capacities of or the doctors in Gaza that would be willing to do the therapy, but it's just not available. The medication for chemotherapy is not available, and radiation is also not available. And so we needed to explain to the international community, and also like from case to case, also to the Israeli officer that are in charge of the medical permits, to explain to them they have to come to us. And this is for children and for adults, and this is kind of a limbo we are living in now, which was caused by the annexation, which hasn't happened yet. But I mean, it's all in the process of this kind of political conflict that we are seeing here. And it's so unfortunate that the most vulnerable and those people that really have nowhere else to go are now bearing the brunt.
I want to just reemphasize the point that the two of you are making. Augusta Victoria is one of a consortium of hospitals providing medical care to the West Bank and to Gaza, to the Palestinian population there. And you provided chemotherapy for patients who could not come to you. So what you did, I want people to really hear this model that you were talking about. You delivered the chemotherapy and other medications to the checkpoints, passed them over to staff of yours who couldn't cross a checkpoint to get into Jerusalem, but who were stuck in Bethlehem, in Hebron too, or in Bethlehem. And then they provided the chemotherapy to the patients there who couldn't make it into Jerusalem. Is that what I heard you saying?
Yes, that was under the COVID, yes, for the lockdowns.
Yeah, no, that's an amazing model. That's an amazing model, and shows how flexible really your staff is and your administrators are in providing medical care. Let's say more about with the lockdown. You're still under lockdown today, is that correct?
Yes,
And
the
again,
lockdown took a
closing-
different format.
Mm.
The lockdown was very strict at the beginning, with literally curfews after 5 p.m. And then there was this opening up, whether be it on the Palestinian side or the Israeli side. The whole country sort of opened up completely. And this was a few days after the Muslim feast of Al-Fitr, after Ramadan. And we were waiting for 2 weeks, thinking, you know, we're going to see just a spark after 2 weeks.
Yeah.
And unfortunately, it started slowly and gradually rising, and it sort of coincided with the second spike of the COVID, just as the whole world and the WHO and the whole world and Dr. Fauci, your end, has predicted. So we are hitting quite a spike. And although you said the numbers, for Palestine, the numbers literally jumped from just below 100 to almost 300 a day in Hebron. We were having like an acceleration of 100% every day.
Are you getting supplies to Hebron? How are you providing medical care to the people in Hebron?
Well, we continue to bring our patients in, which is has been nerve-wracking. We usually bus our patients in, but we've had already 2-3 patients who have tested positive for COVID from their community in Hebron. And this has been very challenging because now, in a way, although it's very tense, but in a way, somehow we now accept that we know we will find some people who will test positive because the endemicity is so high in the community. And a lot of our patients, our dialysis patients, adults and children, come from Hebron. And we were looking at the risk. It was much less risk to keep having them come every day than put them all in a hotel together when you have no control on mixing. Because at first, under the first COVID outbreak, we basically accommodated all our patients in hotels. We had 120 patients and companions, like 60 patients and companions staying in hotels around the hospital to ensure the service. Now, the lockdown is of a different sort, where we can access people for healthcare, but there is no people cannot go around, cannot hold weddings, funerals, cannot have parties, bars, clubs, the works, so that people at least will not mingle too much. Unfortunately, the spike is not subsiding yet, and we are seeing more deaths than we saw in our first spike. And it's a bit more worrying for us as health providers. And we've had more staff infected from patients than before they get diagnosed. Although we have the PPEs, but I mean, people are human beings. You cannot basically stick a mask on somebody's face and tell them how many times to wash their hands. I must say that I'm proud to be in Augusta Victoria Hospital because we have all the supplies. We have face shields, we have PPEs, although we use them and they're running out and we'll continue to need them. But at least they're available now, and we're encouraging our staff to use them, as we have lots of close contact with our patients. When they're dialysis, when they're chemo, you get too close to their face, too close to your patients for treatment, and staff should really even wear their face shields and not just their masks.
You know, I've brought now 14 or 15 solidarity tour groups to Israel-Palestine since 2001. And Augusta Victoria and the Lutheran World Federation has been one of the main stops for us. And so Augusta Victoria and the LWF have a special place in our heart. And for the over 250 travelers who've come with me over the years. I want to say that one of the ministries and your predecessor, Sieglinde, Mark Brown, has always been very, very a welcoming host. And I'm looking forward to meeting you in person, both of you, when I bring my next group next year.
Inshallah.
Inshallah. One of the ministries that has been very moving for my groups is the mobile mammography clinic, as well as the mobile diabetes clinic. The fact that you go into the villages and the great success, I mean, the flipping of the rates in terms of the kind of palliative care for breast cancer patients and women's health, the great change it's made in the Palestinian villages in and around Jerusalem. And so I guess I'd like for you to say a word about both of those clinics, but particularly about the mobile mammography unit and women's health care in the villages that Augusta Victoria provides. Either one, please, or both, or
I like
both.
that. I'll start and Siglinde will tell you about the bus. The village health work community started, Augusta Victoria used to have clinics in the communities. When the Palestinian Authority came to be and they took on all the primary healthcare services, we saw that we do not need to run clinics as we were more specializing in oncology and nephrology care. However, we realized we still needed an outreach arm to maintain an access from the community to the hospital, especially on a level of screening such as mammography. And we were becoming specialized in non-communicable diseases, hence also diabetes is one of the non-communicable diseases which we were very interested in. And that's why we continued our community services in that aspect. We see the mammography as an essential component to our services because it is unfortunate for me to say as a woman in Palestine that one of the primary killers is breast cancer amongst women in cancer in Palestine, when actually the world talks about cure in breast cancer in the world. We have very poor early detection. We get patients referred to us, women very late in diagnosis. We see women, young women of young ages. And that's why we focus on the villages. And in fact, I'll let Siglinde say the plans now, because we've bought a beautiful new mammography stereotactic so that we can digitally start doing the screening and diagnosis and ensuring that these women get referred to us immediately. This is something new we're planning to do to bypass the bureaucracy of the health system, because we realized we are ethically obliged when you do screening not to wait for the woman to go and fight her way through the health system to follow up to her screening with biopsies and diagnosis. So AVH has taken on now that with all our diagnosed cases in the community, we will be providing the care immediately, even if it's at our own expense, because this is something too complicated to go into in this interview. The ministry has, although a generous health insurance system, but the bureaucracy to go into it means you have to be diagnosed to go into it, which means the women could lose that golden period from screening to diagnosis where they can stand a better outcome of cure for them. And Siglinde can go further about our diabetes and our...
Yes, just to add on that, we just got a grant last year, which includes a digital mammography, and we have to even, construct a specific lorry in order to carry this, and it's €500,000 equipment. So I'm kind of like, we are really very much looking forward to have this, this new machine. And then we want with this digital mammography to have stronger links to our oncology department. So to not lose the women due to the complicated health system. And so we are really very much looking forward to it. And you have to also think that during the COVID-19 period, we could not really run this mobile clinics, which shows us that we have to strengthen our networks in the communities. And this is something that we're going to restructure a bit in the future, to really strengthen our networks there. And because I don't know, but it could be more difficult when we want to reach villages in Area C that are under the danger of being annexed, and then we have to see how we can deliver our services there. So this is quite an important thing, and we have many other events for breast cancer awareness campaigns, and I think this is all. It's a very good move, and it brings Augusta Victoria much closer to the rural areas and to the people, because that's. Of course, we have this wonderful hospital here, but then there are people that can't access it, and that's the whole idea of having a mobile clinic to reach out to those that have difficulties to come here or don't really know or have not the means to do so. With the diabetes program, I think that we have also done lots of awareness raising, and it's now more also to strengthen the networks, to increase the kind of capacities of other institutions to deal with diabetes, because that's more of a public health issue. It's about change of lifestyle. It's not so much, I mean, it needs other experiences and other know-how also, because it's not only medical, it's much about how people live their life, how they, I mean, if they, you know, how is their diet, and do they have, I mean, to understand that what they take into their body is having also an effect. And that's, I think this is because diabetes is still a big issue here for the Palestinian, in the Palestinian health care system. And we want to be more close also to the areas, to give the services there where people are, which is mainly the southern part of the West Bank. And this is also what we're going to do to restructure a bit, to have more strengths and capacities in the West Bank.
Thanks for that. We have a question from one of the nurses in the audience here, asking you about what's the primary cause for renal failure, and is transplantation something that you all do? Is that a reality at your hospital or in the West Bank?
Unfortunately, yes. I know when I say we have that many kids, people usually go, oh. And one of our children has been with us for 20 years. He's a young man now. He's studied to be a lawyer, and he's still with us. Thankfully, he's still living. But unfortunately, there's a lot of consanguinity issues. We have at least 3-4 families. We have the brothers, 2 brothers, or a brother and sister dialyzing. We have lots of blood marriage, and that's when we were saying, and in certain districts like the South, it's still very traditional in that way. The other issues is most probably there has been some serious infections in their young ages that went unnoticed. And in fact, when you mentioned about dialysis and children coming from Gaza, we get babies coming from Gaza just for the diagnosis. Of course, you can't dialyze a child or a baby that comes from Gaza because they'll have to stay here endlessly. But we get babies coming at 4 months, 6 months to be diagnosed with like the kidney problems. And these children are a whole different story as they get weaned and have to come with a grandmother. And not only are they sick, they cry incessantly. And that's a whole advocacy issue on its own. But no, unfortunately, the main reasons are these 2 reasons. And that's why then transplant becomes another challenge, because you can't find a donor from among the family. And unfortunately, Palestinians don't have a transplant system. This is one of the things on the strategy of Augusta Victoria Hospital for the next 5 years, hopefully, that we have to start considering it. Because, and also within the Israeli health system, Palestinians cannot go on any list. I mean, there's no transplant list for Palestinians to enroll on for transplant. People sometimes get lucky, they go to nearby Arab countries like Jordan, if they have a relative or they find somebody. And this is one of our heartbreakers, because we feel we really need to work on it systematically to try and provide transplant, but it's not easier said than done, as I said, because many of them are due to consanguinity. And there is still no system of cadaver donation in Palestine either.
Thank you for that. One of the current projects, and it's a very important and needed ministry, is the Elder Care and Palliative Medicine Institute that's going to almost double the capacity of the hospital. I know that you are, according to your annual report, I know you were hoping to secure all your permits and break ground in 2019. How's it going? How are you doing with the Institute? Were you able to accomplish everything you wanted in 2019?
Well, yes, I mean, this is the Elderly Care and Palliative Medical Center. So we had strong hopes that we would start with groundwork in March. And we have the building license. We got the building license, I think, after 7 years of hard work. And we erected a construction fence, and, you know, to mark the area and to also protect the area. And then COVID-19 hit and everything was put on hold. Also our funder, our donors said that for the time being, things would be put on hold. Now that we are out of the lockdown, we are hoping to resume the work. We have gotten positive signals from UNRWA, who is the implementing partner in Jerusalem. But up until now, we're still waiting. So, I mean, the documents are already also for the tenders, for the contractors to start, submitting their offers for the tenders. And we are waiting for the last clearance from the donor on the documents to go ahead to publish. And then, of course, contractors need like 2 months of time to present something, so that hopefully by the end of the year, work would continue. But I have to say that things are, well, they take time, and up until now we have the fence, but no groundwork. But of course, we're still hoping that this is going to start in 2020. But it was a bit of a setback, as you can imagine, with COVID-19. And we're hoping, we're hoping not to lose our building license.
Say
because
a word about the need for this institute, elder care, and the Palliative Medicine Institute. Say a word about why you're investing so much of your energy and time and money in this kind of an institute.
Because palliative care is a new concept, which is not really known. And it's not only, I mean, it means like you look at the person in a holistic way, that, after treatment with cancer or any other diseases, that the person can be treated in dignity, that they don't have pain, that they are cared for. Because I'm also increasingly here in the society, the families are not able anymore to deal, with their elderlies that need intensive care, or with people that have diseases and still need to have a quality of life. So that is a new concept which we want to introduce into the Palestinian healthcare system, and it's a real need. I think this is why we got also the building license from the Israeli authorities, because there is a lack. Also here we are dealing with an aging society and with more need for care for the elderlies. And I think that Augusta Victoria is very well prepared to do that, because we have our oncology. We are already dealing with people in a very specific life, part of their life cycle. And so it's supposed to have 140 beds. So it would be, I mean, once it started, it would be one of the biggest construction projects in East Jerusalem. And people are asking questions: when is your hospital ready? Because they're thinking either of their parents or of themselves, to have a safe place, to know when they need help and they can't be treated anywhere else, that they could go, that they would come here. And I think, yes, I think they also expect a very high standard of treatment and dignity in that from that institution.
If I may add,
follow up on that. And Dina, as you answer this question too, could you say a word about how many patients Augusta Victoria serves in a year,
right,
on average?
Well, basically, we have done I just want to continue about the palliative care. What Siglinde said, we are already a lead in that we have the only skilled nursing facility on our premises. It's a ward within our hospital, although we said oncology and nephrology, but we have the only skilled nursing facility ward for the elderly in our hospital in the whole of the Palestinian territories. There's no other like it. Within the Israeli health system, there are similar wards, but we pride ourselves that we have a very good outcome of pressure sores, healing, treating, like Siglinde said, people elderly with dignity and within their same culture. This is very important. Yeah. Palestinians want to be cared for in their older age with dignity with Palestinians.
Yes.
And that's why. And then as we integrated palliative care already in our services, we realized the need. And so that will be more encompassing. I just wanted to add that we're already there. The numbers, I mean, we have at least on a daily basis, we have 1,000 people usually coming through our doors. We have something like 11,000 people treating them annually, but our numbers under the COVID have gone down tremendously because of Gaza. I mean, we've had, in the last 2 months, we've had no patients coming from Gaza, but we still have some coming for the radiation. Even radiation people have been defaulting. But so this year, the COVID has hit the access to care, which also will affect the patients tremendously. Also, I think the financial situation has affected transfers. The Palestinian Authority, unfortunately, sometimes think they are saving lives by not referring them to a tertiary center and referring them to other centers where they think there are doctors, when actually oncology care is not managed by just doctors. It's a whole system. It's a whole system that includes multidisciplinary teams, safety, quality, and this is an ongoing challenge for us in advocating for our patients with our Palestinian Authority as well. And as finances are cut under a political situation as well, I mean, since the United States also cut all funding to the PA, their financial situation has been challenging. And we as East Jerusalem hospitals have been affected. I have visited with Mark Brown on the Hill to try to advocate for at least maintaining these kind of fundings for East Jerusalem hospitals, because we deal with the humanitarian cases. We are in the business of caring for people, and that's our priority.
Yeah, I'm going to get to, thank you for raising the issue of funding. I'm going to get to that in a little bit before we leave, but I wanted to address this to Siglinde to give you a chance to talk about the other ministries of the Lutheran World Federation Jerusalem program, and 3 in particular, Siglinde. I want you to say a word about the vocational training program, the affordable housing project, and the Mount of Olives sports fields. And with regard to the last one, it's one of the few green spaces, right, left in East Jerusalem. And if I recall correctly, sadly, there's a settlement, right, built right at the base of your property on the Mount of Olives, and it butts up against the sports fields too, if I remember correctly. Anyway, those 3, vocational training, affordable housing project, and the sports fields. If you could say a word about each one of those.
Yes, we have 2 vocational training schools for youth, men and women, one in Beit Hanina, which is East Jerusalem, and one in Ramallah. And as you can imagine, it's becoming more and more important to provide skills for youth that they can make a living and can have also like some meaning in their life. So for instance, in Beit Hanina, we could manage to do some renovation this year, also with the help of a grant for to make it accessible for people with disabilities. So now we have an escalator, and we have something like a ramp, that you can go up the stairs with a wheelchair, which is a real challenge. But also, I think we want to be a model in this field. We have a lot of young men and women, more men, of course, I would say, that in Jerusalem that come from difficult background families. They are, referred to us from social workers from the Jerusalem municipality, and so we have also social workers that help them to get over their issues. They come from families which that are in precarious situations. They have maybe they were not really able to get to get through the school. So. And unfortunately, vocational training here in this country, not everywhere else, but especially here, has kind of a stigma for those that are dropping out. I mean, normally you should go to the university, whereas if you learn your skills as a technician or as a carpenter or as a plumber or auto mechanic or all these different vocational trainings that we are offering, you will find jobs. And so like also what we are trying to do And that it was called, of course, also difficult during COVID-19, that we have strong partnerships with the private sector and with companies that would take on some of the students in their second year. If they are there for a 2-year course, that in the second year it would be less theoretical but more practical in the market.
Sure.
And very often that is an opening to also get employment. So sometimes really the parents come and tell us, well, our child has changed 100%. So this is really this is great. And we have now in Ramallah, we have an additional project which looks into especially to develop new professions for females and for people with disabilities. And we're going to do that together with other vocational training institutes to help them to to renovate their facilities, that it's also more accessible for people with disabilities. We want to have ambassadors, ambassadors from vocational training students, graduates. So you could say like that we are looking for role models that would reach out to the communities, to talk to parents, to talk to youth groups, to tell them what is available, and to make it more attractive to do a practical work. So we have great hopes. There is a lot of interest for donors, because especially also in East Jerusalem, because everybody is looking. This is also when you mentioned the sports field, it's the same thing. Donors want to upgrade the sports field. Unfortunately, it's not really possible, our sports field here, because we have this issue with the settlement. We can't, because otherwise we could have some benches there for people to sit, or to have a little garden, to have cabins for changing and showers and so on. So there would be money and interest there. But because of the differences and with the issue of the land, we can't do that. But the whole idea is for everybody now, what can you do for the Palestinian youth, especially in East Jerusalem, because they're somehow disintegrated, and they are somehow left alone. And I think this is something that really also more people look into, because there's still 300,000 Palestinians living in East Jerusalem, and they have very limited chances to social services. So that's something that we want to increase, and we're looking really forward to that. Now, one word on the affordable housing project. After a long, all the trials, I think from Mark Braun, you might even know more than I do, because he was working for so many years on this. But we have decided now that we want to try to have a construction area for affordable housing in Beit Hanina on 2 plots that are owned by the LWF, and it's just opposite the vocational training center. It's already part of the center is already used by the church once a week for their gatherings. And so we have 2 plots, and there are no obstacles. So it's a residential area. There are no issues there on the land ownership. What we need to do is to unify the 2 plots to 1 plot, which is a procedure on itself, in order to have a bigger, scope for building apartments. So this is what we're trying to do now. We have opened a file in the municipality. It was, of course, all delayed due to COVID-19, but we are expecting that within the next 1.5 years we could have the building license and could start construction. And we are now in the setting up kind of information leaflets together with Mark to start some fundraising. There is also a housing committee with European partners from Lutheran churches. They're also very interested. It's not as big. It's a very humble contribution, I would say, to the housing needs of the Christians in East Jerusalem, because of the whole issue of people not being able to afford housing, which means they would have to find other housing in the West Bank, and then with that they would lose their residency rights in Jerusalem and all their social benefits. And but it's I would say it's a very humble contribution.
I did want to ask you about funding, so thanks for introducing that. When we were at Augusta Victoria and the LWF office in 2018, President Trump had just suspended U.S. financial support, which had impacted for the Palestinian Authority, which had impacted LWF's funding. I read that Germany recently provided 700,000 euros to help you in your fight against the COVID virus. From what other countries are you receiving your support, and where are things standing these days regarding U.S. financial support?
There is no U.S. financial support at the moment.
So, but I wanted you to say, I wanted to hear it from you just in case I missed something.
No, I mean, we have missed 3 installments before. I mean, it's, you know, we are getting annual support from the European Union mechanism PEGAS, in which European member states you know, can provide earmarked funds to specific sectors in order to help the Palestinian Authority to, you know, and it's also this this mechanism is somehow linked also to some kind of reform within the Palestinian Authority. So, and the East Jerusalem Hospital Network is benefiting from this mechanism for the hospitals, but it's also, this mechanism is also there for education and for other sectors. And we have lost now, I mean, it's a real loss, and nobody has covered up for the loss of the American funding. And they at the moment, we have absolutely no funding from the US. Lots of project had to stop also with other organizations. They didn't even have a grace period. It just stopped. And
what about other Arab countries? What about other Arab countries?
Yes, I mean, the ECPMI, the Elderly Care Center, is funded by the Islamic Development Bank, and the biggest funder is the Saudi fund. The biggest shareholder is the Saudi fund, and they have also helped us with the palliative care, the child ward care. So we have a lot of good contact with, you know, with that fund. And other donors were, as I said, the European countries, some of the European countries, so this PEGAS mechanism, and Germany, and also Norway, the Netherlands, and Italy. No, I don't think that it was a national. So I don't want to, I mean, it's not a comprehensive list. Sure. But I have to say that lots of our partners came to our support, because I think they are aware of what we are dealing here. I mean, Augusta Victoria Hospital is not only a hospital, but it's a Jerusalem institution, and it's you know, it's kind of safeguarding the East Jerusalem for the Palestinians in a sense also. I mean, it's and for the time being, as we said, there are no other places for some of the treatment. There are no other places where Palestinians can go, and I think this is very well known by the donors. But of course, I mean, I can only reiterate that our financial situation is very fragile. We don't have lots of, you know, space, and it would be very good if with the new US administration, you know, the aid would come at some point.
Don't sound hopeful, Michael.
You had talked about advocating on Capitol Hill with Mark Brown, Dina, and maybe both of you could answer this. I believe a number of years ago, Dr. Jill Biden, wife of Joe Biden, brought with her some medical equipment and other US aid for Augusta Victoria. Of course, this was a few years ago. What did you find when you were with Mark, Dina, on Capitol Hill? Who are your chief friends, advocates? Are you finding any support? And then the follow-up question, I'm looking around the screen here, and so many of these people are activists in their own communities and with Palestine-Israel networks nationally. What can we do to help? And who have you found to be those kind of organizations here in the US or congressional folks who we can approach?
I mean, that's a big question for me. It was my first experience. It was humbling to see how much work has to go into actually trying to lobby on the Hill for supporting us in AVH. So it was new. I mean, people would, some people were completely surprised by the stories when we mentioned stories about access and children coming from Gaza. They didn't know anything about it. Some people felt there would be no solution except if the government would change. I must say, we were all trying to see, I mean, the advocacy was amongst all the US NGOs as well, who were working in Palestine, like all the American NGOs, trying to see how they could fix that act to get the funds through, because it was affecting all the humanitarian aid they were doing in Palestine and the Middle East. So I cannot really answer to say who your friends or things, but I really believe that everyone is responsible. The US is part of the international community that is responsible for the Palestinians, because Palestine and East Jerusalem specifically, and for us, is occupied territories. Even if Trump decided to call Jerusalem annexed and move the embassy, which has never happened under any US president, this is violation of international law and all the UN resolutions for the occupation of East Jerusalem. We are Palestinians living in East Jerusalem. I'm a daughter of a man who was born in East Jerusalem. My grandfather's house still stands in west of Jerusalem that he had built and left in 1948 when he was ethnically cleansed. And so the international community is obliged to bear their duty towards occupied territories, and Israel is obliged to support the health services that we have a right to in our own country. And so really, I mean, that question should be asked, who the people, how do they feel their responsibility towards us? But we feel people are responsible. They can go blatantly denying all UN resolutions and also using double measures against Israel as against other countries in the world. You know, you have to either stand for all UN resolutions and human rights and advocate for it, but don't use double standards and use one standards with Israel against us as Palestinians and another standard for other oppressive countries that the US works against. And that's all I have to say. It was a humbling experience. I thank all the people. We still had follow-up visits by Congress people who were very listening and could understand the situation. But at the end of the day, we need some action. And we have learned that Israel doesn't care for any resolutions and only actions towards people's rights. Thank you.
Yeah, who from, maybe both of you can answer this one, who from the US Congress has visited Augusta Victoria or the Lutheran World Federation offices?
I can't remember now. I think you should ask Mark Brown or Siglinde.
Yes, no, I'm also not so familiar. And I have to say that, like, almost, you know, we had some visits, you know, anticipated and in our program from staffers also from the Congress. And it was quite an impressive list, but then they couldn't come. So I didn't meet too many people since I'm here because of the situation. So I really do think that Mark Brown is the best person to ask this. And well, yes, I mean, we haven't had visitors, I would think, since February. I mean, has never been like this, I don't think.
Mark, why don't you unmute yourself and then and come on and answer that. Yeah, thanks for offering, Mark.
Yeah, unmute him.
Mark, go ahead. Oh, I have to unmute you, Mark. Okay, well, let me see then. I'm trying to unmute you.
Okay, there we go.
All right, good, Mark. Yeah, there he is. Hey, there's the man. Hey, Mark,
Hi.
go ahead.
Well, yeah, great to hear from Dina and Siglinde. Dina, of course, is exactly correct about the about the Congress and what our prospects are there. One way is to look at the letter. I think about 180 Democrats signed a letter regarding annexation, opposing annexation, and you have about 120 Republicans who signed a letter basically supporting the president's approach to annexation. So that leaves you another 120 or 130 people in the House of Representatives, Republicans and Democrats, who are not declared. And I think it's important for people to look at those two letters, see if their member of Congress is on either one of them, and then also to go after all of those who didn't declare themselves one way or the other at that time. Yeah, hopefully there's going to be some changes, and the goodwill that's generated, I think, by these visitors to Augusta Victoria Hospital. Many have visited over the years, but that needs to be followed up with a lot of advocacy. And of course, in every contact with a member of Congress, whether it's House or Senate, to encourage them to be visiting Palestinian places, especially Augusta Victoria, where there is so much involvement of USAID over the years. You mentioned the visit of the Second Lady Jill Biden back in, I think, 2011. And of course, that solidified the AVH acquiring its, at that time, second medical linear accelerator. So I think, there's certainly an interest, there's some past knowledge there. So if people have a contact with the Bidens in any way, I think it would be good to remind them, if you've visited Jerusalem, if you've visited AVH, to make the connection, to try to push that there would be some very positive things in the Democratic platform, not only about annexation specifically, but opposing the occupation generally. And to continue to always mention the need for freeing up the funding for all of the East Jerusalem hospitals, as well as other USAID funding.
Thanks, Mark.
Yeah,
I appreciate you jumping in, because you bring a certain kind of history, to not only the work there, but then the advocacy on Capitol Hill. And thanks for your continued advocacy on Capitol Hill these days, Mark, part of the ELCA. Siglinda and Dina, I have one last question for you before we close. Both of you are trained as nurses. Dina, one of your areas of expertise is infection prevention. You're both administrators now. How has your training as nurses on the front lines of patient care, how does that color, how does that benefit you in your roles as administrators? Answer that for us, please. Which one would you like? Which one of you wants to start?
Let's see, Glenda start.
Well, it's a long time ago that I was a nurse, but you know what? I think what I learned when I was a nurse, you had to look at the individual patient. You had to make sure that the individual patient gets all the treatment and everything, and the meals at the right time, the medication. You have to see that the patient has to go to, on time to certain diagnostic investigations and so on. And at the same time, you have to look at the whole ward. You have to look at 20 or 30 people. You have to make sure that everything is running. So I think what I learned from being a nurse is to focus on the individual, but not forget the overall the bigger picture. And I think this is something which really helped me in also my other career, and to understand that also people might, you know, especially patients, they feel very vulnerable. They don't know what's happening. They lose control once they are in the hospital, and that you have to anticipate, and you have to support them, that they feel that they have the things again in their hand, or that they feel safe. So, I mean, as a patient, you are very vulnerable, they are very dependent. And this is something that I think you have to, as a nurse, and also as an administrator, you have to think of if you look at the whole operations. So that's what I wanted to say.
Thank you.
I will say it in a nutshell. I think when people ask me, what would you have done differently? I'll say I would, if I were to live my life, I would live it the same all over again. I started from an operating room to public health, and then through my infection control and working nationally. So, and now at AVH. I think nursing really prepares you to think risks, to manage more than one thing at one time, and to think holistically. And most importantly, what I'm using in this is advocating for people. Really remembering, it was very comfortable for me to come to AVH, as I think my nursing prepared me to be in line with the vision and mission of AVH about advocating for patients, advocating for staff, for their dignity, for supporting them, and for patients treating them, and at the same time protecting the institution when thinking of risk. And so really, I'm happy that I had that background, and I think it also helped me think on my feet against everything we're happening today. I sort of think it equipped me to think very quickly on my feet, and that's how I've been able to give to AVH. Thank you.
Yes, thank you. Well, I'm going to let our two guests have the last word, but before I do, I wanted to just mention that our ongoing Indiana Center for Middle East Peace interviews, upcoming programming. In 2 weeks, on July 23rd, we'll be interviewing journalist and author Max Blumenthal. On Thursday, July 30th, we'll be interviewing the president of the Quincy Institute for Responsible Statecraft, retired Colonel Andrew Basevich. And on Wednesday, August the 5th, the founder of Electronic Intifada, Ali Abanima. And so please share that information with your friends. And if you'd like to be on our mailing list, just let me know. I want to just remind you, we want to say thanks to Ben Clemmer from WBOI for recording this to make it available to our wider audience on National Public Radio in this part of the world at a later date. So Sieglinde and Dina, thanks for coming today. Do you have any parting words for us? And Mark as well. I'll let the three of you kind of close up our interview today. So Mark, and then Sieglinde, and then Dina.
Well, I would just say thank you to you, Michael, for pulling this together, this and other webinars. That's really important. And the ELCA is also working to pull some more webinars together that will hopefully bring in an international crowd that can focus. And to say thank you to you, but to say thank you to Sieglinde and to Dina, you know, just really carrying on in, you know, tremendously difficult circumstances, and so gracefully and so faithfully. So just to say thank you for that.
Thank you, Mark. Sieglinde, it's good to see you, Mark. Sieglinde?
Yes, I want to thank you, Michael, and your group, and all the people in the US that are caring and that are interested in to know what the situation is. Because, I mean, with this looming annexation, with this COVID, with this pandemic, with this, you know, this kind of economic crisis, which we will soon see, because there are no tourists, there's nobody coming in. I don't know how people are going to survive. There is a real vacuum that the US is not is not, you know, not involved anymore, or involved in a very biased way. So I really want to thank you for your engagement, and I want to encourage you to raise your voice, because we really need you. People here are kind of desperate. They have lost hope, so thank you for your interest, for your engagement, and please keep doing it, because the Lumen annexation is really something which would be, if implemented, if the US plan would be implemented, it would be having a very difficult impact.
Thank you, Sieglinde. Dina?
Anything you do will make a difference. So please do something. And even though COVID has separated everyone socially, I think we should still think of others, because this world has become virtual now. And we must know that anything we do will touch somebody somewhere else. So take action somehow, somewhere, and you will make a difference. Thank you.
Well, thanks to both of you. I just want to assure you that to the people who have tuned in to us today from all around the country, and even I see some friends from Jerusalem and elsewhere in Palestine, what the Lutheran World Federation is doing in its Jerusalem program and throughout the Middle East, and particularly the programs of Augusta Victoria, they are very, very close to our heart. And so I want to just second what Mark said. Mark, thank you for all your years of service. And to Sieglinde and Dina, thank you. And please pass along our thanks to your wonderful, dedicated staff.
Thank you.
For all
Thank
their
you.
sacrifices day by day. So I want to thank you. Thanks to all of you for coming today. We'll see you in 2 weeks with Max Blumenthal. Get a hold of me if you're not on our mailing list. And thank you all for joining us. Blessings to you all.
Thank you.
Bye now.
Thank you.
Okay, bye. Bye.
Bye. Thank you.
Sieglinde